Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. Today, my guest is Brooke Pate. She's the Director of Maternal and Infant Health with the North Country Perinatal Council, which is headquartered in Watertown. Brooke, welcome to North Country Matters. It's great to have you with us. Let's start by asking you to tell us a little something about yourself and how you came to be doing this work at the council.
Sure. So I've been at NCPPC for about 9 years now. I was actually an educator. I was a teacher before I came into this work. And while I love teaching, I was kind of looking for something that I could do to help families outside of the school day. I kind of saw that a lot of families were struggling in the North Country, and I really thought I wanted to do it more like social services type of stuff. So I saw this position was open, and I thought, how great is this? I can do the home visiting piece. I can kind of see other things that are going on and really connect family to so many resources that we had that I didn't feel like families really knew about. So yeah, I've been doing this work for quite a while now.
You know, you make a great point because one of the things that I have learned over the years of doing North Country Matters is that there are a ton of services up here and so poorly people are so poorly informed about them. And so, we try to make that one of the tenets of this show is to make sure that we can kind of highlight some of these hidden treasures because it is so important that people realize there's help available.
Yeah, absolutely.
So the North Country Council has been around since 1988 when it was incorporated as one of 7 new programs funded by the New York State's Comprehensive Perinatal Network initiative. And it's only one of 2 that was designated for rural areas. And one of the things that we have seen in the last few years is how much rural areas are being hampered by lack of good health care. We've seen hospital closures, we've seen consolidations, we've seen maternity wards that just plain disappeared that were there many years ago. So these are really important services that you offer. Let's start by breaking down the name for folks. Most of us are familiar with the word prenatal, but what does perinatal mean?
Yeah. So perinatal can basically be from pregnancy to a year after birth. So within our programs, we can really see any woman of childbearing age or any father or parenting caregiver. We can work with them, so it doesn't really matter. But that title really means that it's pregnancy up till that child is 1 year.
Okay, so that's great. Thanks. That illuminates that for us.
Yeah.
So describe for folks what kinds of services that you can offer to your clients.
Sure. So we have a lot of different programs at NCPPC. A few of the programs that I oversee are our community health worker programs. So that's in Jefferson, Lewis, and St. Lawrence counties. And we really go in and do all sorts of education. We do pregnancy education, newborn education. We connect our families with any services that they might need. So we'll do like a social determinants of health screening. And if they need help with housing or getting WIC, or if they have issues with providers or even finding a provider, we can connect them with all of those services. So we really kind of meet the family where they're at. We base things off of where their strengths are, and then we make goals with them. And then we work to achieve those goals so they can be short-term or long-term. Within the agency, we also have the Healthy Families Program, which is another home visiting program that is just getting started in St. Lawrence County, but that has been in Jefferson now for quite a few years, and we just recently started that in Lewis County last year. So another home visiting that is really working to reduce neglect and abuse in the home. And then we have our navigation program, which is all about health insurance, making people have health insurance and that they know how to use their health insurance. So that goes through the New York State Marketplace. If people are having a hard time figuring out how to pay any medical bills, we can help them with that with our community health advocate program. And then we have CAP, which is our comprehensive adolescent pregnancy prevention programs. And those are going into the schools with middle schoolers and high school, talking all about that pregnancy prevention piece, STIs, that sort of thing. So those are our main programs. We have a lot of other, little sublets that we do. I have the breastfeeding grant that we were recently awarded. So we've been working on that this year. And then we are working with Canton Potsdam Hospital on a new pilot program to do a light touch. It's called a light touch community health worker, where it will be virtual. So anyone that delivers there gets 3 phone calls from our community health workers just to touch base, see what they might need, connect them with services up in St. Lawrence County. So we will see what all comes out of that program as we get started with that.
So that's really a very comprehensive set of programs, and particularly the geographic area that you cover, which is St. Lawrence, Lewis, and Jefferson County. It's a big geography.
It
So
is.
and it's really hard to get to all the places that you probably need to get to. So using that virtual piece is going to be a nice addition to your repertoire, isn't it?
Yes, it absolutely will be. We have so many people that, yeah, I mean, St. Lawrence County is huge. While we have quite a few workers up there, it's a large geographic area to cover. So we're hoping that this will kind of touch base and it will kind of make us experts based on where people are at. So if they're in Canton, or if they're in Messina, or if they're in Ogdensburg, we kind of know exactly what's going on within their community. And we can say, okay, this is something that you might find beneficial for you or the kids or someone that someone in your family. So yeah, it's a little bit different. It's going to be interesting. We're really excited to get that started to make sure that even in those really, rural areas that might not be Canton and Ogdensburg and Messina, those smaller towns, that they're really connected to those services and know who to reach out to if they need some help.
Yeah, so often it's a case of just not knowing that it's a service is there or how to actually make that connection. So if you can do that for people, it's going to have a huge impact, isn't it?
Yeah, absolutely. Yeah.
So one of the things that we hear about a lot with pregnancy in particular is there are workplace problems and issues that pregnant women and new mothers have to face in the workplace as they go back to work. Breastfeeding might be one of them, enough time to go to appointments, all kinds of things like that. What are some of the common ones that the council can assist uh,
Yeah.
moms with?
Yeah. So I would say breastfeeding is a big one. We get a lot of calls from people that say, I went back to work and I'm not getting adequate enough time to pump, or this isn't really working for me. What can I do? So really making them aware of what their rights are, making their workplace aware of what their rights are. Is a big thing for us. We want to make sure that moms feel comfortable going back to work. So if they are referred to us, as soon as they find out they're pregnant, we can have all of that time to kind of get them prepared. But even if they come to us after baby's born and say, hey, I'm transitioning in the next few weeks back to work, this is my pump schedule now. What's it got to be when I go back to work? We can help them with those things. As far as the workplace, it's a lot of those things. It's making sure that they're able to change into different attire if they need to make sure that their clothing fits if they're required to wear certain, uniforms, that sort of thing. So really any of those workplace things, make sure that they get adequate sick time that they're entitled to, making sure that they're able to utilize that, all those sorts of things we can help with families.
One of the things that particularly breastfeeding moms need is a place to do that, a place to
Mhm.
pump. And a lot of companies have started to make dedicated spaces for that, and others haven't done that. Is this something that you can help companies figure out what is an appropriate space?
Yes, absolutely. So I've been working with a few different places, like McDonald's and stuff like that, because people weren't aware that they had to be able to give them a closed private space, that it has to be something other than a bathroom. A lot of times our moms are having to go into the bathroom. So yeah, we have a lot of different materials that I can just go in and provide to them and say, this is what would be a great space for them. Or if they show me their space, I can look at it and say, oh, well, if you just move this around or did this, that would be perfect for this mom. So yeah, all of those pieces we can help with for sure.
So you're a good problem solver in terms
Try
of
to be.
that.
Don't always have the answers, but I try to be, yeah.
Okay. So, as you know, the recently enacted New York State budget included a first ever paid prenatal leave mandate in the country, offering women 20 hours of prenatal care. How does this work, and is it enough to make a real difference for people?
Yeah. Yeah. So basically the people are entitled to this time now. So it alleviates so much of that stress of, moms have to decide, okay, I have to save my sick time for when baby's born because then baby's going to have appointments and all of those other things. So I think maternally, we always want to put baby first. And so those appointments kind of came in the background because they weren't really at the forefront of mom's minds. It's more like, okay, I've got to save my time. Where with this time, they have a little bit more um, you know, freedom to use those to attend those appointments, which are so important, when it comes to baby's growth, those long-term birth weights, all of those things that we're trying to, decrease or increase for the good things, all of those come at those appointments. So this time really gives people a little bit of that time to just be able to attend those, make sure that they're meeting with their doctors, make sure they're comfortable with their doctors, make sure they know exactly what's happening in their pregnancy. So this extra time will definitely help all of our birthing moms.
And that's a way not to have to burn your leave, your post partum leave time with
Correct.
things that you should be able to take care of before, because obviously before the baby is born, you have as much need to see your doctor as you will need to see afterwards, and the baby needs to see. So,
Absolutely.
Brooke, recently the Federal Pregnant Workers Fairness Act had the final rules were issued by the Equal Opportunity Commission. How do these new rules help women? Because up until this point, it was the law, but kind of the regulations and the setup hadn't been very well delineated for people, had it?
Yeah, it really kind of gives them more of a voice. I guess if they see issues, there's a place where they can actually file complaints. There's a place where that's actually going to be followed through with. Before, I don't think that people really felt comfortable with that. It's really hard to go to your workplace and say, these are the issues that I'm having, without fear of retaliation. So it really alleviates that for a lot of our moms. They're going to kind of have those rights and know what they can do. And it's going to hold the workplace responsible to be able to provide those.
So, when it comes to these federal regulations, is that something people have to go to the EEOC for, or can they come to you and have you help negotiate these rights with the employer?
Yeah, so they would first want to go to their employer, check out things with them, see what's happening. Everybody should have some sort of human resource person or somebody that they can go to. And then if they don't, well, we don't do litigation here, we could definitely, if they needed help filling out paperwork or if they needed the connection to services, NCPPC would be able to provide them with those connections. While it's not something that we actually do here, we would definitely ensure that everyone is getting what they would need from whomever, for sure.
Right. And of course, a lot of it is probably just employer education. Did you
Correct.
know you had to do this? And
Yes.
if
Yes.
this is like the first time they've had a pregnant employee, it's a learning experience for everyone, isn't it?
Absolutely. It's just like when paid family leave first came out, there were so many questions surrounding that. What does this look like? Who's entitled to it? What's the paperwork when people are eligible that we have to fill out in order to turn that in? Who turns it in? So yeah, so many questions with all of that, which I think, as time goes on and we kind of go through all of it, we'll know a little bit more for sure.
So let's talk a little bit, Brooke, about the current trends in maternal and infant health. I've been doing a lot of reading on some of these issues, like the birth rate is being down all across the country, women who delay their childbearing to later years, maternal death rates, all those kinds of things. What is it that you're seeing at the council here in the North Country?
Yeah, I mean, I would say that our biggest issues that our families are facing are financial burdens. With prices skyrocketing for everything, our families are really struggling. Our working families are barely making ends meet with what they're getting, and the cost of living is really expensive. So I would say that, and just your typical social determinants of health type things, like housing is a huge issue. Childcare is a big issue. We're in a childcare desert up here. All of those types of things, substance abuse, mental health stuff, getting on waiting lists to be able to see mental health providers is really big for a lot of our families. So all of those types of things that, 10 years ago probably were a big deal are now an even bigger deal. So really for us, it's meeting families where they're at, seeing exactly what their immediate needs are, and then addressing those as well as we can. We don't always have the answers, but we make sure that they're connected, make sure we're getting those referrals in, and making sure that they realize that they have a support system out here and that we're going to do our best to make sure that we're alleviating some of those headaches and stressors for them.
Yeah, you make a good point about mental health services, and this is certainly something that the COVID crisis really brought forward, is how many people need mental health services and how few mental health services there actually are. And I know that the state government is working on doing that, but of course, you don't just wave a magic wand and say, well, we're going to pour money into this problem and it'll go away, because you still have to have trained people. And you have to
Correct.
have trained people where people need them to be. So getting for you folks understanding what the services are in each county must be huge in order to be able to do those referrals.
Yeah, it is. We do a lot of different coalition work and do a lot of meetings so that we're up to date on exactly what's happening and where. If we refer to one place and then that therapist leaves, that affects a lot of our families. So it's like, okay, that person's gone. Who can we connect them with now? All of those sorts of things. We had to think a lot outside of the box when it came to COVID. So we did a lot of teletherapy, a lot of those types of things. So it's definitely changed in the last few years with COVID, with all of the mental health piece. So, but we have great providers in the Tri-County area, and they want to get people off the waiting list. They want to see our people as soon as they can. So they work pretty well with us and getting in our families when we need to, especially those ones that, are higher need and really need to be seen sooner rather than later.
Yeah, right. And again, it's one of the things that helps to prevent family problems with kids in the family if the parents are so stressed out. That we know that can lead
Yeah,
to bad things. So
absolutely.
it's important that people know that the help is available and know how to get the help. So
Yeah.
your role in that is really important.
Yes.
Um, let's talk a little bit about teenage pregnancy, because from what I read, the rates are definitely down. So that's some good news, isn't it?
Yeah, that is some good news. With our comprehensive adolescent pregnancy prevention going into the schools, we actually got an addition to that. So we're going to be going into more schools. They've already started that and we're hiring more people, especially in St. Lawrence County. So we're really hoping that those numbers continue to decrease. But I think it's just awareness of what's out there. I know that with the state passing the bill that they could get free birth control in the pharmacies, get 3 without having to have a prescription is huge for us. But it's also just that education piece, making sure that everyone feels comfortable going in and having those conversations and that you're not alone and that there are services that can help you with those things, really to reduce that so that every pregnancy ends up being an intended pregnancy.
Right. So a question, you mentioned you're now able to go into more schools. Are the schools for the most part welcoming you in, or do you still meet barriers there
Yeah.
depending on where you're trying to get in?
Yeah, there's some barriers, but for the most part, the schools that we're in now are fantastic. That's a different program than what I oversee, but I know that they've been open and we kind of go into one school and then it seems like the next school is contacting us saying, "Hey, I hear you're doing this. Could you come over here and do that?" So that's been great. The
That
more
word
that
of
we can
mouth.
get out
Yeah.
there. Yes, yes,
Well,
absolutely.
that's good. And nothing succeeds like success.
Yeah.
So if you and no one wants to see a high school student drop out of school because of an unintended pregnancy because they can't figure out how to,
Yep. I know.
maintain everything they need to maintain.
Yeah.
So tell us a little bit, Brooke, about the local resources that are available in addition to what you folks at the council can offer.
Mhm.
What are the other things out there for people?
Yeah. I think that there's so many that people don't know about. One avenue that we use a lot is SPOA. It's a single point of access. We use that in all 3 counties, and that is really everyone that does some sort of social services, providers, all sorts of things, all meet in one meeting. If you are willing to be presented at SPOA, you can be connected with so many services, and the people that sit on these meetings know everything. They know where they can go, who they can be contacted with, all sorts of things, and who takes their insurance, those sorts of things that can kind of, get in the way of those services.
Mhm.
But there's, WIC, there's Cornell that does some parenting education. There's all sorts of services. We refer to TLS for behavioral health and those sorts of things, Credo for substance abuse. So I would say 50% of our time is getting referrals out. We're working with the families, but they need a lot more than what we do. So we make sure that they're connected with those services. And I do think that there's so many that people in our community just don't know about. And our community health workers are really experts in that field. They're knowing exactly who to send and where to send them and how to do it. So we really can make that connecting piece, which is really nice.
That's so good to hear, because it is difficult for people to say to begin to even know where to go, and then they find out where to go, and sometimes just picking up that phone and making a cold call is so hard.
It is
So
hard.
the
Yeah.
fact that you can shepherd them through that process
Yep.
is such it eases everything.
Yeah.
So Brooke, if someone is looking to get in touch with your council and they begin to explore some of the things that we've talked about today, how do they do that?
Yeah, so they can either go on our website, which is just www.ncppc.org, or we have a Facebook page. They can message us on there, or they can follow our page to learn about things that we're doing. One thing that's always on our Facebook page is our Family Opportunity Center. I forgot to mention that we have that in Watertown and Governor now. They're doing all sorts of activities for families. They did an Easter egg hunt and all sorts of different fun things. So if anyone's interested in those activities, those are always on our Facebook page as well. But they can do that, or they can call our number 315-788-8533, and they can get connected that way.
So a question, is there an automatic process if someone has a baby in the 3 counties? Is there an automatic process for them to be connected to you folks, even if they don't think they need you, at least they have that information?
Yeah, for the most part, all of the hospitals have all of our information. Some of the hospitals just refer everybody to us, and then we make that call to them to just, check in and see how things are going. But everybody, all the hospitals have our information. So yes, they're referring a lot to us.
Okay, good. So
Yep.
in a given year, what are the numbers look like in terms of newborns in the 3 county areas? How many new clients are you taking on?
I would say for ourselves, we usually see about 400 clients in the Tri-County area for all three. Most of those, about half of those turn out to be long-term, which means we see them up until that baby is age of 2. Some of them are long-term. I would say about 100 of those are, short-term that we just kind of help them with what they need. But that's just our program. So Healthy Families has their own capacity, and then we have the people that get referred to insurance and all of those. But there's a lot more births than that. So we really do miss a lot that are getting, that are having the babies that aren't getting referred. So we are constantly always trying to do that outreach to the hospitals, to make sure that we're reaching those people. We always say we want to be a preventative service. So we want to get the referrals before, someone's turned into CPS or someone, has something happen that we don't want to see happen. So, the earlier we can get the referrals, the better for sure.
That makes a lot of sense. One more question along those lines. Because Fort Drum is in the Watertown area, do you have a big presence on Fort Drum? That's are all young families there for the most part.
Yes, there is. And yes, we can go out to Fort Drums. My program as well as Healthy Families can all go out to Fort Drum. Yes, we have
Okay.
lots of families out there. Yep.
Okay, great. Well, as we wrap up today, Brooke, and I want to thank you for how comprehensive your program is and how well you've described it. What are your final thoughts? What do you want people to think about the Prenatal Perinatal Council going forward? They've heard a little bit about it now, and give us your little elevator speech. If you were meeting somebody on the street, what
Yeah.
would you tell them about your
Yeah.
work?
Yeah, I would definitely tell them, if you found out that you're pregnant or you're parenting or if you're having any sort of issues, to contact us. We can come out, we can meet you where you're at. Even if people aren't comfortable with the home visits, we can meet them at a Dunkin' Donuts or a McDonald's or whatever they're comfortable with in that initial stage to build that relationship. But we are definitely a support. We're here to help you, and we can definitely make sure that, your pregnancy has the best outcome, that the infants and newborns have the best outcome, and we can meet with you up until baby's age 2 or age 5, depending on which program you do. But our health insurance, our Family Opportunity Center, our CAP programs, everything is pretty robust, and we're out there doing lots of things. So come check us out.
Oh, that's great. Thank you so much. I appreciate that. Um, the uh, the whole becoming a new parent thing can be scary all by itself without
Correct. Yeah.
there's a lot to learn, and
Yes,
it isn't always good to
absolutely.
learn by the seat of your pants if there's
Yeah.
someone can take you by the hand and kind of walk you through the process. So it
Yes,
sounds like
definitely.
that is your job.
Yes, it is. Yes, it is. For those first time or if this is your 5th or 6th baby and you're just still figuring it all out, we're
Yeah,
here.
there you go. Well, I appreciate your time today, Brooke, and I appreciate the work that you're doing. And I hope that more people will think about giving you folks a call, because I don't know any young parent or new parent who doesn't need a hand and doesn't need an
Absolutely.
advice and doesn't
Yeah.
need a little help finding a service. So you sound
Yes.
like you guys are you're the go-to.
Yes. Yes. Absolutely.
All right. Thank you so much for coming in today.
All right.
Um,
Thank you.
These conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.